I guess this is a wonderful venue. I must admit I've never been here before. I'm a big rib person, so I guess it's full circle. I wasn't here, but the rib shack is here, but I would have been if I'd known about it. Um, but thanks to you, thanks to Lydia, thanks from my wife, all the organizers for this tour that we've been doing. We just want to go out and educate people. And I also want to introduce, I've been doing this 35 years now. And so I've been doing this mostly solo, and it's a heavy lift, I got to tell you. But I'm getting up in years. It's clearly I'm on the back nine of my career, and so I need help. So I wanted to introduce my colleague who's going to join us here, Dr. Sima Banerjee. Welcome.
Hello, thank you. I'm very happy to be here. I'm Dr. Banerjee. I'm joining Dr. Lipman. Very excited and to looking forward to being a community.
Woo! Yes, it's outstanding. You can't wait. So I speak to a lot of different groups today, since it's kind of centered around food, and people may say, well, I thought you treat fibroids. Like, what does fibroids have to do with food? Well, actually, quite a bit. And so one of the questions that comes up commonly, well, before I ask that question, let me start by, does everybody know where fibroids are? Everybody pretty much knowledgeable. Fibroids are the most common Helvin tumor seen in women. It's common in all women, but it's particularly common in women of color, African American women. They disproportionately suffer with these benign tumors. So while these tumors are benign, they're not cancerous, which is brave. But in some women, they can cause a lot of misery, a lot. It's the number one reason why women have heavy periods. So we can talk about periods. It might seem odd that a man is interested in periods. In fact, I would always, when we was talking to the community, I've always wanted to see other men, because that's part of the problem. Because there's a lot of, you mentioned earlier about, not talking about periods, period shame, period poverty. We contribute a lot to women's sanitary products. Not only here in Atlanta, there's a tremendous group here in Atlanta called You First. If you ever encounter that group, they are doing angels work in Atlanta. In fact, then the head of this works for Delta. And when Delta changed their color scheme, now they were going to throw away all these blankets because, they were red blankets, now they're blue blankets or whatever it was. They were throwing them all out. Well, she went by and collected all these blankets, and she goes one by one to all these underpasses and gives them blankets.
Oh, wow.
And we contribute to their hygiene kits. So they package these kits for just simple things that we all kind of take for granted. Soap, washcloth, toothpaste, toothbrush. And she assembles these kits. Well, we provide sanitary products for her kids. But she is a true angel in our community. So anyway, I've welcomed, talking about periods, because part of the problem that we're facing, this lack of communication, is there is, in some families, we don't talk about periods, or there's some shame involved, or they don't understand what's happening to them. You are the CEO of your body better than you. And so, you got to take a little ownership on that. And when something doesn't seem right, bring that knowledge to whoever's caring for you, whether it's a primary care physician, whether it's an OBGYN, and talk about it. You should be able to ask any questions. You shouldn't feel that, and if you feel like you're being dismissed or not being listened to, find somebody else. There are plenty of excellent doctors here. When I see patients at the Atlanta Fibroid Center for a new patient consultation for fibroids, that consultation is at least 30 minutes and more like 45 minutes. Me and the patient, not a mid-level, not a nurse practitioner, a PA, somebody else. That's physician time, which I get like 5 minutes when I go to the doctor. It's usually an TA or the nurse practitioner, and the doctor breezes in and out.
That's not how we practice. I think you would see a completely different model coming in the fibroids there. But anyway, so fibroids are very common. It's the most common reason why women have heavy periods. And it was a long way of saying sometimes we don't realize what they're doing is not normal. If you bleed heavily for a long time, you might think it's normal because you've done it for a long time. You may ask your mom, and your mom may have had fibroids and bleeds heavily just like that. And like, well, she bled like that, I'm bleeding like that. That's our lot of life. And I go to my doctor and I talk about it, and they don't seem to be very interested. So I guess I'm kind of stuck with being a heavy bleeder. No, you don't have to be suffering like that. Fibroids are hard and firm. They're like rocks, and that's how they cause their symptoms. So wherever they're located, they'll press on things. If they're located next in the lining, they'll cause the heavy bleeding. If they're next to the bladder, they'll press on the bladder like a paperweight and causing fecal urinary frequency because the bladder's not allowed to fill its capacity because it's being compressed by this rock-hard fibroid. And some women can feel their fibroids, or it makes them look pregnant. They go to the doctor, and the doctor will describe them as a certain size pregnancy as it enlarges the uterus. And so they can cause pain. They can cause all sorts of symptoms. And if you're suffering with fibroids, oftentimes you bring those concerns to the OBGYN. Makes sense. They're the gatekeepers of women's health. The problem is, the gatekeepers of women's health, OBGYNs, they're all surgeons. And I've never met a surgeon that didn't like to cut deeply. And for benign fibroids, you don't have to cut on people anymore. We've been doing this amazing procedure called UFE, Uterine Fibroid Embolization. It's also called UAE, Uterine Artery Embolization. Same procedure. We've been doing it here. We did the very first one in the entire southeastern United States back in the late 1990s. So we've been doing it a long time. And yet, despite that, most women who go to their gynecologists, they're not even told about it. They're only told about the surgical options, which come down to two. And it boils down to whether they're interested in fertility or not. If they're not interested in fertility, hysterectomy. If they're possibly or definitely interested in fertility, it's called a myomectomy, where they cut the woman open, take out a number of the fibroids that they can safely get out, and sometimes they end up with hysterectomy because they get into bleeding or trouble, which is kind of staggering because half the population doesn't have a uterus, even though I think by office I do. So 50% of people in the country aren't even eligible for the surgery, yet it's second most common surgery done. And again, if you have a myomectomy and you get pregnant, and you'll determine your time, you're going to get the number one surgery done in the United States, which is a C-section. Our patients who've got pregnant, and the fertility rate is the same as the myomectomy patients. So 60% of our patients that wanted children got children, which I think is kind of fabulous because our patients tend to be older, 35 to 45. And a number of them have already had a myomectomy, which we know drops their fertility rate because you cut on that uterus, the scar tissue and so forth diminishes their fertility. Our patients have been typically full-term and vaginal breasts, which is outstanding. Okay, so hysterectomy, second most common surgery done in the United States, most commonly done for fibroids, which are benign. The average age of hysterectomy is less than 40. But I've met way too many women in my journeys, less than 30 have already had hysterectomy.
Wow.
And that's just tragic. I have daughters that age. It's absolutely tragic, absolutely unnecessary. In fact, there are over 1 million women sitting on the sidelines. You call it silent sufferers. All they've been given is hysterectomy, and they don't want it.
You have an option, you probably have what I got in college talking, but I do have two young boys, young teenagers, whatever, going in their 20s and going in their 30s. And so it isn't her